Hi, I'm a week after my surgery, open heart bypass. For some reason they call it cabbage, and I think it's coronary artery bypass graft. Could be wrong. In my case, I had 4, and it covered apparently 5 or 6 or something different blockages within the muscle of the heart. So there are 3 main arteries of the heart, and the bypasses, even though there are 4 of them, covered different branches to get covered up. So last Friday, January 24th, 2014, I went in for that surgery after various testing and so forth a couple of weeks prior, and finally ascertained that that was what was needed. So I thought I'd go over a little bit about kind of what's involved and different, do a little geography lesson. Let's see. Well, let's see. First off, they have to get into the heart. Funny, on the day of surgery, I get all prepped. I get shaved pretty much head to toe and clean and everything, and they connect an IV. I've got all sorts of marks and everything all over me now. So I had an IV here, or a site for an IV, which stayed with me the entire duration of the hospital. I had one over here, I think, for a while, somewhere.
And one in the thumb area.
One in the thumb area, somewhere over here.
I think we had one about right here, and then had another one
Or was it this hand,
right
maybe?
here.
Anyway, so 1 or 2 on each hand, I would guess, or arm. So that is kind of the first step. So I'm wheeled into an operating room. It's kind of creepy because you go in, and I really didn't kind of take too much of. It didn't totally hit me until I had the abundance of staff in the operating room and this huge plates of equipment, clamps, and just stuff all over the place. It's like, man, who's getting all this done? And how it felt like. So I don't remember being put to sleep at all. They keep you awake on the gurney into the room so that you can assist getting yourself onto the operating table. So once I'm on the table, I guess pretty quickly they put me under, and for the next 4 to 6 hours.
I think it was less than
Something like
4.
that. So, I'm not entirely sure what order is what, but I guess we'll continue on the geography lesson. So, I'll tell you what, it knocks your energy right out, and it's difficult to, you have your energy knocked, and then you think you could just stop and rest for 10 minutes and you'll be good to go. Not in the slightest. So I'll just take my shirt off here. Arms are pretty sore. I'll tell you why in a minute. So I have obviously this incision right down the middle, and in order to get to the heart of this area, obviously it's not through an angiogram, angioplasty, where they do it through the groin. It's not arthroscopically, or whatever it's called, where they do it through, spots like you might do stomach surgery. This is, they cut you wide open. So the sternum, where all the ribs come together in the front, the sternum is top to bottom, and I think on mine it's about 9 inches or something. And so they, first thing they do, I guess, is cut through all the topsoil, if you will, the meat and the muscle, and they get down to the bone, and then they use. So I saw, unfortunately, I watched a little bit of somebody else's, and it's a pretty hardcore angle grinder, sawzall kind of a thing that cuts you up right down the middle. So once you're cut open, they literally just kind of pull you open, and they use
Retractor.
retractors, I guess, whatever, things like that, that hold you open and keep it open. And I asked the surgeon a couple of days after surgery, well, how wide does that really get? How wide do you need? And he goes, well, because I needed all three of them. That means the surface of the heart on this side and effectively on the back side. That means they got to open it up pretty far. So in the process of that, he said it was open. He kind of put his hand like this when he did it. So because everything is being stretched out, your ribs, where they all connect elsewhere, and all the interjoining muscles and tendons and whatever are, they get beat up. They get pushed around and moved in places that they've never been before, and so it just beats you up. So I wondered at one point if I had a cracked rib or two, because the pain was quite intense, like pinpoint. So, and it was difficult to breathe, as it still is. Anyway, so in my case, they took a graft, an artery of my own rather than, say, fake or somebody else's, that in my case came from my leg. But they also took it from just below the breast muscle. They don't even disconnect both ends. They take one end that used to go to your breast muscle, let's say, from the underside of it, and they pull that off, and then they put that into a spot in your heart, so that whatever blood was originally going to that muscle is now going into the heart instead. So it's kind of clever. It does definitely give it a sensation of sort of pulling, especially in the first couple of days. It sort of felt like, these arteries are not, they don't really pull. I thought they do, but that's apparently more of a vein. But the arteries are more, this is the length and that's the length that stays. You can't just kind of yank on it and pull it around like a hose. So I don't know how many are in that from that purpose or not. I think maybe only one or one small one. The rest were taken by a graft supply from my leg, which in my case came from my left leg. Fortunately, they didn't take anything from my arms, which is good. I mean, I'm a painter and I'm a guitar player and so on, and so I would hate to have, it wouldn't be permanent supposedly, but it would be a lot of additional pain that if I could avoid it, it would be better. So anyway, in my case, they took it from my left leg only, and they quite literally, they opened a spot, if you don't mind here, do this carefully. I've got quite the bruise there. So they put a hole here, and then they put a hole, obviously where this is, and they, with some, they call it telescope, which is kind of weird. Apparently they use a scope down inside, and they follow the length of it from inside your leg, and they make sure it's a good candidate for a graft. It's got to be there for a long time, obviously, and it's got to be healthy, and it's got to have good connection, disconnection locations. So it used to be, I guess, they would just simply cut you open and pull it out. Well, now they find it here, and they find the same one over here. For me, it's kind of like pulling wire. And once they know, they like it, they quite literally cut it here, and then pull it out. It's simply gone. And there's enough other arteries, veins, vessels, whatever, that support the legs, especially in time, that it can recover fairly well. So I'm able to walk. It's a bit strange the last couple of days, now a week later, but it's so I'm pretty numb right here, apparently from the lack of maybe that blood flow, maybe some nerve damage, I have no idea. So the other thing they did is they, not only from here to here, but the same from here to here. So in my case, I have the full length of my leg is taken out as a graft. and they use that. Ouch, they use that as a replacement to go around the blocked locations within the arteries of my heart. And just for clarity, the arteries for my heart are to supply the heart muscle itself. They're not for the blood flow that takes you to the rest of the body. It's not like the flow that goes from the heart and in and out of the heart. No, it's the heart, it's the muscle, it's the blood flow to the muscle of the heart. You know, you cut off the muscle of the heart, cut off the vessels to a muscle, and you end up not having good function or at all of that muscle. So, I learned later that the graft that they use, I haven't confirmed this, but my understanding is that the length of it, they actually flip and put it inside out. So the tube is, the smooth side of the tube is more or less the outside when we're talking inside the body. But when they want it the other way around. So they want the smooth side on the inside, and apparently that gives a longer last.
It's a vein instead of an artery, and so an artery is directional in blood flow, so the vein, they turn inside out so that it can act like an artery.
Yeah, there's some ambiguity on my part at least, and what's going on there. But I understand they flip it inside out, so it's nice and smooth, and it doesn't have any natural valves and things like that prevent the flow of blood going one direction or the other. I don't know. I obviously, considering the length here, they surely didn't use all of it. So what becomes the excess, I guess it goes into a bonfire somewhere. So again, on my chest, kind of forgot this, I have these 3 spots here and here. And so I guess at the end of the surgery, they put in these tubes, semi-soft tubes that have holes in them to drain out whatever excess is going in there, whatever wasn't sucked up, whatever's oozing in the process, and for that matter, whatever may be leaking after they close you up. They would rather you leak, through a planned tube than to have you just fill up. So they put 3 of those in, and they're surprisingly long. When the guy took them out, I don't know, does that sound unusual? I think they were probably this long as far as the area under the skin. So they went into, I guess, 3 areas, I don't know. And so they came out these 3 holes. And these holes here, which are healing pretty nicely, were apparently they put in small wires to have at the ready if you have any electrical issues. For instance, they need to put a pacemaker on in a hurry, or at least get you stabilized that way, and your heart's not cooperating properly. And rather than cut you all open again, and what you need is a quick pacemaker. It's not meant to be permanent, but it gives them an ability to connect electrically to the heart. So for a few days I had, I think it was basically an open syringe that housed a bunch of wires inside of it. So if they had to, they just pull it off and connect to those wires. Another spot I had, now that I can feel it, is a central line that was put in here. I'll tell you, it feels about 10 times bigger than it appears. It's quite stiff. Of the piece they took out, I thought it might be some soft thing, and it's not. And as I understand, the purpose of it is to, I guess it's one of the first things they put in you, is to be able to get different medicines right at the heart right now. So if you put it in the arm, it's got to get its pathway in, and sometimes time is more of the essence, or it gets sort of lost in the pathway to the heart. So they put a line right into the aorta, if I understand right. And again, it's kind of a loop shape, and so they stuff that in, and boy, it's a lot more sore I kind of anticipated. And I guess maybe because it was so stiff, I can't imagine what it's like when I'm moving around. Wrap it up, she says. So during the surgery, in order to do all the sewing or whatever, they have to stop the heart and put me on a heart-lung machine that does the work of the lungs and the heart for me. And so that's kind of scary for me. And so they stop the heart. I guess, after they've connected, disconnected, whatever. And I guess there's some overlap. You're not just on the machine or on your heart. There's some little bit of overlap there. And so they stop the heart, have me go through the machine. Obviously, I'm completely sedated, and they do their work. And from what I could kind of gather on some paper we had, I'm running out of time.
Yeah, you have a little bit left.
Apparently the heart was stopped for about 2 hours. So it's kind of weird to think that in my entire lifetime, my heart finally had a chance to rest. You go to sleep and your arm's quiet and there's nothing happening, it's more or less, but your heart never gets to ever rest. So it's kind of weird to think about that. So I'll tell you more another time. That's the end of today's story.